Hello, everyone. Thank you so much for joining us. Happy Tuesday. Today's guest has actually been on our IG Live before. We'll be joined by Dr. John Norian, a reproductive endocrinologist at HRC Fertility in Los Angeles. Dr. Norian and the HRC Fertility embryology laboratory and the reproductive genetics program offer patients the state-of-art technologies and then drive their world-renowned success rates. And in fact, they also have a very high success rate for LGBTQIA plus families. Dr. Norian is well trained in the needs of queer families, including how to choose a sperm or egg donor. So we're going to discuss special considerations couples should make, how to pick a donor, and other tips, making this challenging but exciting process to go smoothly. So I'm going to... Here you are. How are you?
Hello. Hey, Jenna. How are you? So good to see you and the team at Million Marker. I love it.
Yeah, it's been a little while. How are you?
I am well. It's a rainy day here in Southern California.
Oh, same here.
My gosh, this Pineapple Express, all the storms they're getting tiring, but that's okay.
Yes, and we're going to talk about exciting topic today, which we have not covered and much needed.
Yeah, I'm excited to speak about, some of the details related to talking to patients who identify as LGBTQ plus, and in some of the ways that they need to be aware about their family building and selecting donors and all sorts of things.
Absolutely. So before we begin, for those who have not seen you on our IG Live, do you mind telling folks a little bit about yourself, how you became a reproductive endocrinologist?
Sure. So I'm John Norian, Dr. John Norian. I'm a fertility specialist, reproductive endocrinologist. I'm based here in Southern California, in Los Angeles area. And I did a lot of my training on the East Coast. I did my fellowship at the NIH in Bethesda, Maryland. But then I'm originally from California, and I came back home. And I'm now with the practice HRC Fertility. And we have a wonderful team, Team Norian. And the thing that makes me tick is clinical care. I love taking care of patients, but I'm so curious that I'm still involved a bit with research, with asking questions. We have some embryologists and, fellows in reproductive endocrinology who are, still asking good key questions. And we have partnered with USC Fertility and other universities here in Southern California. That it's really great. We have a good water cooler conversation, I guess you might say. So
I can see one of your patients just comment or one of your staff, best doctor.
Oh, it's, doing high level fertility care very much takes like an attentive team, nurse, physician, but also a wonderful embryology lab. And then I also very much partner with patients that we work with to really communicate as best I can so they can build and provide the best eggs and sperm that their bodies can provide. So
this kind of covers a little bit of the service that you provide. So egg donation, sperm donation, IVF, what are the other services that you provide to your patients?
Yeah, so one of the other key things is also egg freezing, very much so. And, I have very few emergencies in our field, but one of them is an oncologist, dear friends. Many of them have my cell phone number, and they are like, hey, John, hey, Dr. Norian, I have a younger woman with new diagnosis of cancer, and we want to see about options to preserve her fertility. So the answer is always yes. We can see her the next day or two, and we'll start the process. So egg freezing, believe it or not, sperm freezing, particularly people with LGBTQ, people transitioning. I was at a little weekend trip this weekend and speaking with a high-level OBGYN in our community, and we were talking a lot about the role for fertility preservation in trans females, and then also talk about it for trans males and some of the nuances there.
Wow, it can get pretty complicated.
Yeah, but it's so good we live now. Imagine healthcare if we didn't live now. I mean, gosh, penicillin, insulin were developed like almost 90 years ago. Imagine living in a world without that. And now our embryology labs, our medications are very refined. And with fertility medicine, we've really been able to not only screen and optimize sort of the building blocks, the eggs and sperm, but optimize our culture medias, our petri dishes, and our incubators. There's all these little details that have allowed us to culture embryos at a much higher rate.
But besides all the technology, you add a lot of love on top of that, which your practice value is like love is love. So tell us about that.
Yeah, very much so. I mean, walking the walk of fertility or, identifying as LGBTQ, I very much just want to help everyone add to their families. I come from an ethnic group. I'm very American. I love America, and I try to make it as good as I can. But I very much want to take care of everyone, right? And whether you're single, whether you're in a same-sex relationship, whatever it is, I want the joy of having a family, adding to your family, your parents' families, your cousins' families. We have tools available to do that so you can have a biological child. And doing that, you really need a doctor, a nurse coordinator who are good communicators, who are responsive, who are there to support you, when you're taking the hormone medications. And when you're going through the process, sometimes there's some ups, downs, and communicating with someone about the wiggles of fertility is really helpful. And I think we try to do our best. And, I usually tell people I narrate as I go. And I do a lot of my own ultrasounds, not all of them, of course. And when I'm doing an ultrasound, I'm checking in. How are you doing? How are the medications going? How are you feeling? And then I sort of narrate, this is the follicle, the lining, things like that.
Like, I feel like with this, particularly this group, the high touch is really essential. And then like the doctors and also the care providers really requires a lot more training and even like special setting to best serve this community of patients.
Yeah, I mean, I think that, having these deeper layers of knowledge, especially when you get into unique situations of, maybe you didn't get as many eggs as you thought you might get. Maybe the sperm was going to be lower than you anticipated. Whatever it might be. Dr. Norian, why did all my embryos arrest at day 3? Or, these unique questions, having these layers of extra training, experience, definitely can help. And, back in the day, I did cell culture myself. I mean, they were fibroid cells. But I remembered how, we were working with immortalized fibroid cells, how difficult it was to get them to grow and proliferate. And then we would subject them to all sorts of experiments so we could better understand their development or dysregulation. So
for a couple who's like about to start the process, how do you help them decide, which one will be the one to use their genetics for reproduction?
Right. So are we talking about 2 women? Are we talking about 2 men? What do we?
Both. Let's talk each one too.
Okay. So why don't we talk about women? Okay. So, when I'm working with gay women or women people who have 2 female sets of female parts, let's call it that, because remember, gender is more fluid. Is that we typically like to work with the younger egg source, right? So the person who has younger eggs, ideally from 20 to 30, that would be wonderful. But of course, we take care of many, many 30-year-olds and even young 40-year-olds and have great outcomes. So age of the egg source tends to be key. Then you want to know about other things, like are her cycles regular? Are they not? Does she ovulate? Like if you use an ovulation predictor kit and you want to do donor sperm inseminations, it's really nice to be able to time things. Yeah. And the ways you can do that best is if a person is cycling pretty regularly. So age, other factors. I take care of many people with male parts, people with female parts who really struggle with obesity, right? So we don't ideally want people to be overly heavy, right? And I come from a family where we have a lot of cushion and that happens, and we are all just doing our best, myself included, is we want to choose the healthiest uterus source, right? So the womb, maybe we do this regularly where we have what we call reciprocal IVF, where we retrieve the eggs from one future mom, and then we create beautiful embryos, and then we transfer those eggs into the other future mom. And the egg source may be younger, the womb or the uterus may be healthier. So these are some other factors that very much come up. Of course, we're going to do testing. We're going to do AMH levels, FSH levels. I also do like a broader panel, thyroid levels, vitamin D, prolactin. I love checking a person's cholesterol panel because then I can tell metabolically, how are you eating, right? Because if your HDL is crazy low and your triglycerides are crazy high, there may be some things we can work on from a nutritional point of view.
What about for to a partner with the male reproductive organs?
Right. So as far as working with men, people who have testicles and the male plumbing, is as far as how do we optimize sperm. So usually I tell guys, number one, do your best, take a fertility-focused vitamin. So those are going to be vitamins that are rich in antioxidants, things like vitamin C, zinc, selenium. There's some data for L-carnitine, also coenzyme Q10, things like that. Technical. Oh my gosh, at some point you can only take so many vitamins, right? Eat healthy, right? Have salad every day. Have oil and vinegar. Try to minimize simple processed carbohydrates or just simple carbohydrates. You want to get moderate exercise 4 to 5 times per week, 20 to 30 minutes a day. It's not over the top, but just getting blood flowing through the body. In study after study have shown slight improvement in male semen parameters, male fertility. And then avoiding toxins, right? And this is where you come in, Jenna. This is where Million Marker comes in. Because guys who smoke, guys who use cannabis, guys who are ingesting lots of plastic or petroleum every day, they have worse quality sperm, right? Even now, Shanna Swung, right? Countdown, or when we're all exposed to chronic low-level toxins, we have lower quality sperm, right? Phthalates. What the hell is a phthalate, Dr. Norian? Oh my God, you're going to laugh, Jenna. I have a child who's in 5th grade. So think about when we all were in 5th grade, human development, right? Health class. Oh my gosh. So I guess beforehand, they do the health class and they're like, hey parents, this is coming up, this is what we're going to be teaching, a little FYI, you might want to have a talk with your child, or there might be some funny things that come up around the dinner table. And they sort of bring up some of these things. I'm, of course, the reproductive endocrinologist who's like, so will you guys be talking about ways to optimize future fertility in 10 to 15, 20 years and minimizing exposure to phthalates and, PCBs and things like that? And the poor teacher, the moderator, couldn't even say the word phthalate, which, I just found amusing. But, yeah. So anyways, fragrances, try to minimize fragrances, shampoo, use better quality shampoos, at some point, we can all only do so much, and we didn't choose when we were born. So, just do your best.
You mentioned Dr. Shauna Swan. I actually think Dr. Shauna Swan joined our live today. I think I saw her joining earlier. So thank you for joining, and we love your work.
Oh my gosh, she's awesome. There's like conversations you'd like to have with someone. Sometimes, or like in any society or things like that, She is she's a thought leader, which is really great. And I know a lot of the work that she does is pretty mundane and epidemiology, these big studies, but raising the issue is so important. And we see a lot of food advocacy people out there, especially on Instagram. Sometimes it gets a little overwhelming, but there's a reason they're there, because our we really all got to do our best to choose, what we're eating, what we're ingesting into our bodies, because it's hard to make good choices sometimes.
Absolutely. Well, we need Dr. Shauna Swan to keep doing her research to give us all the stats, but we need you to really translate the information to the patients, because I think many times patients, they just don't read studies, right? They come to their doctor, especially when they're going through their fertility process. So you're like absolutely key to deliver this information to patients and really help them reducing toxins.
Right. Well, very cool. One of the things that I know you wanted to chat about is, choosing sperm.
Yes.
Right? Donor sperm. So Dr. Norian, how do I choose donor sperm? So then I have a few questions right back at you. Okay, what technique are we going to use to help you add to your family? Are we going to be using inseminations, IUIs? Because if we are, our success rates with IUIs, it's going to be lower throughout the world, right? We're going to have in favorable patients just doing Clomid IUI, 8%. You do Clomid IUI with HCG, with ultrasound monitoring, maybe you get it up to 10, 11%. You do it with injectable only HCG monitored IUI, maybe you get it to 15 to 18%. But at some point, our success rates with basic IUI treatment sort of max out around anywhere from 12 to 15+%. So if we're doing a success, and if we're choosing donor sperm IUI, we need more sperm available as far as that goes. So we need more vials of sperm, especially if you'd like to have a sibling in the future, right? And remember, donors get retired, and typically when you work with a donor, we're going to be working with a cryobank or a sperm bank, and they've already been pre-screened. They've already gone through full infectious disease screening. They've already had psychological testing, genetic testing, legal clearance, right? This becomes your sperm, your embryos. So the idea of getting 10 to 15 vials of donor sperm, if you're doing IUIs, donor sperm IUIs, is not crazy talk. So that would be one thing there that I would say. But if you're doing it in vitro, you need less sperm. And I know that donor sperm can be expensive, but if you're doing IVF, you get 2, 3, 4 vials, because pregnancy rates, implantation rates in favorable patients with screened or unscreened embryos with or without PGT range anywhere between 50 to 60, 65%, per single embryo with or without PGT. So in a good uterus. So those are some of the things that I would say. Number of vials really depends on your treatment. And also, do you want to have siblings, or do you really want to have a male or a female or things like that? So those are things to talk through with your doctor.
But also people sometimes also wondering, do you really want to know your donor, choosing a known versus unknown donor?
Yeah, thanks for bringing that up. So in this day and age, we all know we're not all anonymous, right? With facial recognition software, with 23andMe, Ancestry.com, genetic testing, just to, for whatever genetic reason, the fact of being completely anonymous is more difficult than it was, say, 20 years ago. Now, the idea of being a known donor, sometimes we work with, let's say, if I have 2 women that I'm working with, maybe the brother of one of the future moms. So that's sort of a cool way for her to be able to have her family's DNA carry forward. And if we do that, we can do that. You just have to go through all the FDA requirements. You have to screen the male. You have to do a proper exam. We have to do infectious disease screenings. We have to do infectious disease screenings through an FDA accredited laboratory within 7 days of sperm collection. So there's some rules by this. And then we do a genetic panel and legal. We always need a legal contract because as much as family is family, this stuff sometimes can get complicated. I will say when you work with a known donor who's a friend, family member, you will know as they get older, hey, did you get like blood pressure at an early age? Did you have an early heart attack, God forbid? You know, and that might be something that you would want to communicate to your child. But it also gets complicated because let's say you're at a gathering, a family gathering or party or who the heck knows, and someone's maybe had a little too much to drink and they sort of spill the beans before you're ready, or it wasn't maybe the way you were hoping to, then that can be hurtful or upsetting or things like that. So you just have to follow the guidelines, do what works for you, need a good cryo facility. And there's in America probably 15 good accredited cryobanks, if not more. And at some point, you don't overthink it. You just need sperm. So,
but HRC and you and your team actually walk people through this process, right? And also like provide additional resources for them, you know, if they need any legal counsels or like which cryobank to use, and you would give them the recommendations.
Very much, very much. We have preferred ones that we like, that we work with. Fairfax Cryobank is a really good national cryobank. We help them with some of their egg donor or egg freezing, because remember now there's not just donor sperm banks, there's also donor egg banks. So we have a nice relationship there. But other ones there's, you know, throughout the United States, there's good cryobanks. And yeah, very much so. I have like a good list of reproductive attorneys that we work with, therapists for psychological assessment and screening, making sure people are doing this for the right reason. They're not being coerced. And you sort of think through, okay, how am I going to feel maybe in 10 years, 15 years if I did this now? Will I be okay with that? And yeah. And honestly, thank goodness for it. It's a wonderful, like, what a way to pay it forward. I think, I mean, giving the gift of family and life to people who need sperm is, it's awesome.
So if somebody is getting the sperm from the cryobank, obviously their genetic has been screened, and but if they're not, do you also recommend not only the intended parents getting their genetics tested, but also the donor?
Yeah, very much so. And I'm glad you brought that up, because you know what? Different cryobanks have different levels of genetic testing, right? Mm-hmm. Some of them will do a big old panel. They'll screen for over 300 inherited genetic disorders. Others will do more like very limited screening, like cystic fibrosis, SMA, sickle cell. And you're like, oh, by the way, there's like 300 things you could also screen for. Of course, many of them are rarely occurring. Many of them, their penetrance, their effect in clinical disease may be lower, but sure, wouldn't that be nice to know? So you have to ask your cryobank, how big a genetic panel are you using or not? And then, yeah, of course, the intended parent, it's always good to screen the genetics of the egg source, or if you're, you know, for gay men, the sperm source. Because if you do carry a mutation, which is very common, then you can go back to the cryobank and be like, hey, I've got this like cystic fibrosis thing. Can we make sure that the sperm donor, let's say you're a gay woman, doesn't carry that exact point mutation? Because remember with CF, here's an example. Of the CF gene, there's 1,800 variants of the mutation. Like, ouch, that makes my head hurt, right? But like, I mean, the big ones, Delta 506, there's a few that are like higher penetrance of disease. Those are ones that are probably more important. So,
wow. So it's so important for a patient to work with someone as knowledgeable as you. Tell us, like, you know, what a session with you look like.
Yeah, well, I mean, come on, Jenna. I thank you for the kind words, of course. So, the way it works, you call my office, find me on the internet, just Dr. John Norian. I'm also with HRC Fertility, and just schedule a consultation. I take care of people, you know, throughout the world or the United States. Of course, I had more of a local practice here as well. And usually we start with the consultation. We figure out, we ask, okay, whose eggs, who's to carry, whose sperm, you know, all the direct questions. And then we start optimizing. We talk about ways to optimize your fertility. We talk about the particulars of cryobanks, of legal, and then we do an assessment to get a better idea about a person's reproductive health. And we go from there, and then we make a treatment plan. It's exciting. You leave the initial visit with a treatment plan.
That's efficient.
Yeah, I mean, here and there, things will change. And of course, not just meeting with me, but you also meet with the nurse coordinator. You meet with our financial insurance coordinator, so you have a better idea about cost and insurance. And then, really the goal is to just start treatment sooner than later. So
I know HRC has such high success rate. I know that you guys have like so many like comprehensive services. Besides what people can see, what are the things that you think would make the success rate so high?
So I think a lot of it is we put a huge amount of focus into our embryology lab. We have wonderful embryologists. We have team members who are all hopefully paddling in the right direction, right? It's very team oriented. Team Norian, we do a lot of things to keep our team strong and have fun, but also just be attention to detail. It's like my Uncle Ed. Oh my God. We all have like phrases we live by, but it's like attention to detail. So at those ultrasound appointments, we're going through our checklist. We're going through all these little details to allow us to just have the best outcomes of retrieving eggs and sperm and things like that. And just creating good, high quality embryos and being transparent, being fair, partnering and communicating with patients so they have realistic expectations.
That is amazing. Wow. Thank you so much for sharing all this knowledge today. And then we're going to have to invite you back to talk more about different topics. So thank you so much.
I love it. Jenna, so good to speak with you. And keep up the good work at Million Marker. Screening for toxins is no joke. It's important.
We're trying, but we need partners like you, Dr. Norian. So we will continue working together.
Love it. All right. Well, all the best.
Yes, thank you. And thank you everyone for joining. And then be sure to follow Dr. John Norian and also HRC Fertility. And then learn more about Dr. Norian's service, by clicking our LinkedIn bio. And we're tapping the post promoting this Instagram Live. So thank you so much.
Thank you. Have a great afternoon, everyone.
You too. Bye.
Bye.